Happy Friday. Today I want to talk a little bit about the mechanics of liposuction and where we can do lipo and kind of what goes on with the process. So liposuction can be done head to toe basically. So we can focus on the submental area, which is like the chin and the jawline. We can do liposuction of the upper arms, liposuction of the upper and lower abdomen, the waist, and the mid back or the bra rolls. Lipo 360 generally refers to liposuction that's done of the abdomen, the waist, and the back. So we can do it there. We can also do the inner thighs and the outer thighs. So those are the main areas that we can perform liposuction. So if we're doing lipo 360 or more areas of liposuction, say like lipo 360 in thighs or something like that, then usually we do that in the operating room so that the patient's nice and comfortable and asleep. But if it's just like one or two areas, like for example, the abdomen and the waist, or just the arms, it's very straightforward and simple to just take care of that in our sterile procedure room in the office. So kind of what goes on with that is that the patient, at our pre-op appointment, we prescribe some medications such as a Xanax, and then Norco, which helps with pain control, high-strength ibuprofen, Phenergan, which is an anti-nausea medication, and an antibiotic. And so the day of surgery, when they come to the office, we give them these pre-medications before we start the procedure. Then we numb some areas where we're going to make the small nick. So the lipo cannula, or the wand that we use, is very long and narrow, and the access point is like less than a centimeter long. So it's a very small access point. So we just take a tiny gauge needle, same needle that I use for Botox, which is 30 gauge, and I numb up the skin just to make that little tiny nick incision. After that, then I inject the tumescent fluid into the areas that are going to be liposuction, so into the fat. The good thing about fat is it doesn't have a lot of like nerve receptors and stuff, so it's not very painful when the tumescent fluid is going in. And what is tumescent fluid? So tumescent fluid is lactated ringers, which is basically what constitutes our body's makeup of fluid. So it has different electrolytes and such. And then epinephrine to help decrease blood loss. It helps constrict the blood vessels. And lidocaine, which is for pain control. So after that goes in, then we wait a little while for the epinephrine to take effect. And then we start the procedure. So when we do it in the office, the patient's awake, talking to us. They're a little groggy from the Xanax and the Norco and the medications, but overall, they're totally with it. And it's not very uncomfortable. If you're in the operating room, then you would go completely to sleep, and then we do all the same steps. You're just asleep. But so that's basically what we do with the liposuction. After we inject the area of tumescent, and then we use the cannulas, which are the long, thin, like wand-like structures, to get the fat out. And so using that tumescent solution really helps. So yeah, if you have any questions about liposuction, then feel free to comment down below. Usually we try to limit liposuction to patients who have pretty good skin tone. So like massive weight loss patients and stuff wouldn't be good candidates for just liposuction just because of the extra skin. We just have to cut it out. Otherwise it just will end up looking worse. But yeah, so if you have some extra fatty areas that are really stubborn, then lipo's a great solution. So I hope you have a wonderful July 4th weekend, and I will see you next week.